All right. Good morning, everyone. Today is Thursday, April 13th, 2023. We're excited to provide you today's school health update and want to thank you for your time and joining us. This continued partnership is really meaningful, and we hope that you find today's topics helpful. Let's go ahead and jump right in. On today's agenda, we'll have some brief announcements. We'll share again information about the Not Alone initiative through Pima County Health Department and Cope Community Services. We'll also talk about COVID-19 and give you some updates around transmission and community levels. We also have a mini presentation on rabies today from our EPI department, and then we'll proceed with a brief Q&A here at the end of the meeting. Feel free throughout the presentation to put any questions in the chat that you may have, and we'll monitor those and get to those questions here at the end of the presentation. As usual, Narcan is available for schools. So this is a tool to reverse overdose, opioid-related overdose. And so it's just a good idea to have someone trained on your staff and have Narcan available in your school should a situation like this arise. If you're interested in getting these materials and some brief training about Narcan, you can email the school support at pima.gov email. We also have presentations for staff, youth, and families about fentanyl and other opioid-related drugs, as well as substance use in general, addiction, and so on. We also have COVID test kits available as usual. These are available for pickup at our warehouse, and we will follow up with an email with this presentation. And so there's the link there for you to request those test kits. We try to make that as easy as possible for you. You can also schedule on-site COVID-19 vaccinations at your school for staff and students this spring. And so all you have to do is contact PCHD's Vaccine Equity Program to organize a COVID-19 vaccination clinic. And that email is vaccineequityscheduling@pima.gov. We continue to offer emotional wellness presentations for staff and students. These presentations can be modified to meet the needs of the school. Typically, they're about an hour in length and they're interactive. So if you are of the digital age, I invite you to take out your smartphone, open your camera app, and hover over that QR code here, this little blue square, and that will prompt you to open a link. That'll take you to the form where these presentations are available. As you can see, we have topics that include practicing mindfulness, managing stress, trauma-informed care, PACS tools, and Text Talk Act. And so you'll be able to see the delineation between what presentations are available for students, for staff, or students and staff. And we invite you to review those and see if any of those might be useful for your student community or your staff communities at your school sites. And so this one, I'm particularly excited to share again with you. So Not Alone is a youth mental health initiative here that Pima County Health Department has collaborated with two organizations to bring to you, to add to the toolbox, to start addressing or continue addressing the mental health needs of our K through 12 youth and staff communities. So we know that 1 in 3 teens are struggling with mental health. And so what the Not Alone initiative aims to do is link young people in Pima County who are just looking for support, whether that is they're stressed in general, maybe about school, academics, maybe they just had their first heartbreak and they're struggling with that and just need someone to talk to, or maybe they're experiencing symptoms of depression or anxiety or just general feelings of feeling overwhelmed. And so again, with this QR code, we're implementing this in schools where students are able to see these QR codes throughout their schools. In TUSD specifically, you should start to see these out in all middle schools and high schools. We're working with Dr. Joseph Gaw and his team, as well as the leadership in the district. And we're aiming to get those out to y'all in the next week or two. So big things coming down the pipeline in terms of that. We are implemented in a few schools already, and we're starting to see some engagement, which is really exciting. So what this looks like is the servicing agency for the counseling piece, the meeting with the behavioral health technicians there with their youth team. We're using Cope Community Services as the servicing agency. And so their staff is prepared. Once a young person or a staff member goes to this QR code and they fill out the form, a member of their team conducts a phone intake assessment. That is the point at which parental consent is sought, and other initial demographic information, as well as scheduling. And so this is available in in-person and virtual options. It's also available in any language. So we are utilizing interpretive services. And then for students that or families that need ASL interpretation, that is also available through this program. So we wanted to make sure that this was as inclusive and equitable in terms of being able to access this resource as possible. And then likewise, we also know that there's a lot of youth and student leaders out there who are already supporting their friends and could benefit from having more tools in their own toolbox. And so we're partnering with the Born This Way Foundation. They have a peer-to-peer support training program called the Be There Certificate. And it's all free, all virtual. And so through this link here and this QR code, youth and staff can access both of these options. And so that's the Not Alone initiative. If you're interested at all, please do email us at notalone@pima.gov. If you're interested in having this in your school, we will prepare materials and deliver them. And so, whatever it takes to best serve our young people, that's where we're at. And we want to help you do so as well. Again, email us at notalone@pima.gov with questions or inquiries about this initiative. All right, and then so now I want to turn over and I believe Anissa, you're on the line, or Matt Christenberry, one of y'all are going to take this. Looks like Matt. Thank you so much.
Yeah,
and welcome. Take it away.
Yeah, well, thank you. Yeah, so just the usual updates for our COVID situation. Currently, we're at a low community level, so that's good news. As I looked this morning, all of Arizona is at a low community level, so that's good news. Typically, we see one or two counties that are not in the low level. So the updates will happen later today from CDC. In addition, looking over. If we look over our other metric here, we are at a substantial rate of transmission. So, again, some counties in Arizona are still in that high community transmission, and Pima County currently is at substantial. So that keeps kind of fluctuating a little bit here and there. And as you can see, we did decrease a little bit, about 10% for our case rate, and then also for our positivity rate went down about 1.5%. Good news, we are still continuing to see some upticks in the bivalent updated booster for the ages 5 and up. We're at almost 24%, so hopefully we'll continue getting that number up. Next slide, please. And as I highlighted, this is one of the first times I've looked at this map when there was so much green. So I think that is good news overall. Just a little bit of high community levels, mainly in Texas and up in the northern part of the U.S. So next slide, please. Again, just highlighting here how the indicators are determined from the CDC. And as I mentioned, we're at a low community level. Our case rate is about 55 cases per 100,000 population. And then the new COVID-19 admissions are 2.2 admissions per 100,000 population. And just right at 1.5% of staff and patient beds are used with individuals that are confirmed COVID-19. Next slide, please. This map looks quite a bit different. A lot of different variability here within Arizona, as I mentioned. All of our counties are either high or substantial, while there's a lot of states around us that do have moderate and some low community transmission levels. So we'll continue to monitor this. As most of you know, this really just impacts the recommendations for most of our healthcare facilities on, for example, like using source control, which would be masking and those types of measures. Next slide, please. All right. Well, I'll kick it over to my colleague Andrea.
Welcome. Thank you so much for presenting, and Andrea, take it away.
Okay, so I'm going to talk a little bit about rabies in Pima County today. Next slide, please. The first thing we need to do when discussing rabies is to know exactly what it is and how it works. So rabies virus affects the central nervous system, which prevents the brain and the spinal cord from working properly. Once rabies symptoms begin, it's always fatal. Rabies only occurs in mammals, so we aren't going to see it in things like birds, frogs, reptiles, insects, nothing like that. It's usually spread by saliva from a bite or a scratch. And in 2022, Pima County had 25 positive rabid bats reported, and we did 119 rabies risk assessments, not necessarily all on bats, dogs, javelina, other things are included. One thing to note, though, is that there weren't just 25 rabid bats in Pima County total. They're just of what we tested, and rabies is more likely to spread between wild animals than between wild and domestic animals or wild and humans. Next slide, please. So here's just a few statistics from ADHS. So in 2021, there were 53 domestic animals in Arizona, all of Arizona, that were exposed to a rabid animal. So this is very low considering it's the entire state. If a domestic animal is exposed to rabies, they should get a booster shot within 72 hours. The last rabid cat in Pima County was in 2019, and the last rabid dog was in 2007. So make sure you vaccinate your pets. And Pima Animal Care Center does a good job in promoting pet vaccinations and rabies vaccinations. Next slide, please. So bats and skunks and foxes are the animals we're going to see the most rabies in Arizona. The most common source is bats, and always remember and pass it on to your students and teachers, do not touch bats. They might look cute and furry. They might look like they're dead, but they just may not be moving at the moment, and they're not necessarily dead. So rabid bats often fall to the ground where they're easily accessible to pets and humans. So a lot of times we have somebody call their dog brought them a bat, and we will do an assessment to determine whether they need rabies post-exposure prophylaxis. Exposure to rabid bats usually occurs when someone picks up or handles a bat. There are situations there where somebody is bitten by a bat, and they're really hard to see the bites because they're very small. Other rabies exposures can occur when people try to lure wild animals to them, so please don't do that either. In some cases, rabid animals attack humans, and bats, skunks, and foxes once again account for the most rabies in Arizona. Next slide, please. So we talked about rabies affecting the central nervous system. So now we're going to talk about some signs and symptoms that we might see in rabid animals. So in a domestic or wild animal, you might see chasing of the tail, staggering or inability to stand, excessive drooling, frothing at the mouth, biting at objects like tires on bicycles and cars, and unusual aggression. And if you look at the animal, the dog in the upper right corner here, This is a picture from the CDC, and this is a rabid dog. So in wild animals, we might see any departure from human behavior. Um, so a nocturnal animal like a bat, if it's out during the day, then that's not typical, and it shouldn't be out there because that's not what they do. Also, if an animal seems unafraid, um, then that's an indicator that there might be something amiss also. So please try to just avoid animals. If you see an animal, a wild animal that you think is injured or hurt and want to help it, call Arizona Game and Fish or a place like the Tucson Wildlife Center. Next slide, please. So these are just some pictures of the animals most likely to contact rabies in southern Arizona. They all look very cute, but realize that they all can have rabies. So don't approach them. If they appear hurt or injured, like I just mentioned, call Arizona Game and Fish or the Tucson Wildlife Center. Next slide, please. So this talks about bat proofing your home, and I know I'm speaking to a school audience, but basically most of the same things apply. If you find a live or dead bat in one of your buildings on campus, then call Pima Animal Care Center. They will come out and pick up the bat and take it for testing, send it to the state, and also call Pima County Health Department for a risk assessment. So we know about the bat at the school. We'll get the results of whether it tested positive or negative. So if you see any holes like in a gymnasium or another building on campus, you just want to make sure that it's filled in. And one thing I wanted to point out, we see these 3 little cute looking bats on the bottom, and we can see how small they are and how a bite by a bat might really not be visible. Unfortunately, last year, a minor had told their parents that they were bitten by a bat, but there was nothing showing on their skin. And unfortunately, the minor did develop rabies and they did die. So it's really important that Pima Animal Care Center and the health department be contacted if you find a bat or another wild animal on your campus. Next slide, please. So we get reports from a lot of people. The general public calls us with questions. Either they were bitten by a dog or a bat, or they had a run-in with a bat or a skunk or something else. So we get calls from them. We also get calls from healthcare, like emergency rooms and urgent cares, asking our opinions and in getting information on what we might think of a bite, and whether they need post-exposure prophylaxis. But we have to talk to the patient because we ask very specific questions. We hear from community partners like schools, businesses that may find a bat on their campus or outside of their doors that's scaring customers away. Also, we sometimes hear from government agencies because sometimes people call the Arizona Department of Health Services rather than their local health department. Next slide, please. So if you're bitten or exposed, call Pima Animal Care Center and they'll issue a bite report. But before you do that, make sure you wash the exposed area with soap and water for about 10 minutes. So if you have a student on campus that has had this happen, do the same thing to them. They need to wash it with soap and water for 10 minutes. So call back PAC, Pima Animal Care Center, and call the health department for a risk assessment to determine whether you need post-exposure prophylaxis. prophylaxis. And so that's a series of questions that we're going to ask you in order to make a recommendation for treatment. Some questions might include the circumstances of the exposure. We try to determine whether it was a provoked or an unprovoked bite, and we try to get a description of the animal. Is it a known animal or an unknown animal? Especially in domestic animal cases. Next slide, please. So this is about post-exposure prophylaxis, and I'm just going to be very brief about this. So if a person needs it, some of people from my generation, they used to give you a series of shots in your stomach. They don't do that anymore. If you need PEP, you have to go to an ER. You should call them first and make sure they have the medications, human rabies immune globulin, and 4 sets of rabies vaccines. So we'll stop there on that. And next slide, please. So in summary, don't touch bats or any wild or unknown animal, whether they're dead or alive. Don't try to lure wild animals to you. Vaccinate your pets and stay up to date on rabies vaccines. Call PAC if you have a live or dead bat on your property, or if you have a dead wild animal in your yard or neighborhood, and call the epidemiology department for a rabies assessment and guidance. Thank you.
Thank you so much. And so just in general, as you can see, our EPI team is very supportive of our school partners, and we're very eager to always get information out to you, as well as support you with issues that are occurring on your campus. And so we invite you to continue contacting the EPI team at epi@pima.gov when these sorts of issues come up, or if you have any sort of outbreaks, which we've discussed on previous calls. You can also reach them at that phone number that was previously mentioned, 520-724-7797. A member of our EPI team is always there to answer the phone. You may get a voicemail if there's high call volumes, but they're very good about getting back to you very quickly. And then also, if you would prefer to fax, or you need to fax over any sort of documents, 520-838-7538 is that number. All right, and that brings us to the end of our meeting here. So we'll start closing out. Just a reminder, we have moved to a bi-weekly schedule, the first and third Thursdays of each month. Our next call will be Thursday, April 27th, again at the same time, 9 a.m. In the interim, however, you can always reach us at schoolsupport@pima.gov or our school support phone line, 520-724-7018. And here's some associated resources from some of the pieces of the presentation today. And now we will, and then yes, again, you can always reach us at the phone number there and the school support email, but you can also go to pima.gov/healthy-schools to see all of our school support resources that are available. And that brings us to the end of this part of the presentation. And so if you have any questions, we'll hang out in the chat. And we're happy to answer any if you have those. All right. I'm not seeing any questions pop up in the chat. And so just to honor your time, I'll give you 7 minutes back. And just again, super appreciate these partnerships with our school champions, and look forward to seeing you in 2 weeks. Thank you so much.